I'm Dr. Krishna Jain, a vascular surgeon. I'm the Chief Medical Officer of Apex Health Network, and I'm the founder of Limb Preservation Centers of America. What is a limb preservation center? Limb preservation center consists of 4 pillars. Pillar number 1 is managing medical conditions. Pillar number 2 is management of wounds. Pillar number 3 includes revascularization of the lower extremities as well as managing venous ulcers. Pillar number 4 is management of diabetic neuropathy. What do I mean by medical management? Medical management consists of managing patients' underlying medical conditions, for example, diabetes mellitus, for example, hypercholesterolemia. Or if the patient smokes, the patient needs to stop smoking. We need to institute exercise therapy, supervised exercise therapy, which can sometimes prevent an operation. So all these medical conditions need to be managed as the first pillar of limb preservation. What is the role of a wound care center? I'm a vascular surgeon. I took care of wounds all my life. However, I was never trained in taking care of wounds. So when you send a patient to a wound care center, the people there are specializing in taking care of wounds. They use the latest techniques, resulting in greater incidence of healing of the wounds. Not only that, they can use hyperbaric oxygen therapy when appropriately indicated, and this also results in helping heal wounds. What is the role of revascularization? 50 to 75% of the patients who will come to the wound care center will have decreased circulation to the feet. So until the circulation is increased, these wounds will not heal. So these patients need to be referred to a specialist who can revascularize the leg. This can be done in an office-based endovascular center, popularly known as OBL, or it can be managed in an ASC or in a hospital outpatient department. And sometimes, about 25% of the time, patient may need an operation, and that operation be carried out in the hospital. The most timely care is provided in an OBL and an ASC. So it is important in a limb preservation center that we have access to timely care for revascularization of lower extremities. What can be done for peripheral neuropathy? Many patients coming to the wound care center will have diabetic neuropathy. Diabetic neuropathy causes severe pain in the legs, as well as the patient has no sensation in the feet and they step on things that starts the ulcer. Recently, a new device has come out, which is a high-frequency device, which is a spinal implant. And once implanted, it does 2 things. Number 1, it takes care of the pain. And the earlier data shows that some of the sensation in the feet can come back. And that holds true. Patients may not get ulcers. So it is an important part of a limb preservation center that we manage diabetic neuropathy. Why do you need a limb preservation center? The main reason is the care is fragmented. For example, as a vascular surgeon, when I did revascularization of the lower extremity, I had to wait weeks for a patient to be seen by a specialist who were managing wounds. I had to find an internal medicine doctor who will manage their risk factors. And in our community, there was hardly anybody who was looking at the diabetic neuropathy and managing with spinal implants, etc. So a limb preservation centers put all the pieces together, all the 4 pillars together, so that we can save limbs. And I hope you can join us in crusade to save limbs and lives. Thank you.